Welcome to First Issues. A few weeks ago, we started a series on the most common lifestyle disorders in Botswana with pharmacologist and consultant cardiologist Dr. Kiran Bhagat. So far, we have covered obesity, cardiovascular diseases, and asthma. The doctor is back again tonight, this time to shed some light on a well-known lifestyle disorder, diabetes. Doc, thank you so much for coming back on First Issues. We're continuing our series on the most common lifestyle disorders in Botswana, and today we're going to be talking about diabetes following our discussion on asthma. So,
diabetes is interlinked with the other lifestyle diseases we talked about. We talked about obesity, we've talked about heart disease. There is almost, if you like, a fateful alliance between being obese and being diabetic. Mm-hmm. In very simple terms, diabetes is a condition where the body has a lessening ability to parcel away, remove the sugar that you consume, because you've abused the system, the control mechanisms, and the mechanism is called insulin. It is a chemical that the pancreas manufactures the moment you eat something sugary, because sugar is a poison, in very simple terms, which is the reason why people during caveman days had very little sugar. It was only during seasonal times where fruit was there, and if they're very lucky, they found a beehive and had honey. Otherwise, there was no sugar. We know that sugar is toxic, and we know that the sugar in our foods has resulted in an overstress on the pancreas. As a result, we have insulin resistance, we have insulin burnout, and as a result, the sugars begin to rise in the body, and that causes diabetes. There is basically two types of diabetes. One is called juvenile onset, and the other is called adult onset. However, the two have almost merged in the sense that what we defined as adult onset is now occurring in children. The type 1 diabetes is basically where the baby is born, or the child eventually develops a situation where the pancreas is destroyed, what we believe by today's 2024 standards, by an autoimmune process where the body attacks the pancreas and the child is not able to produce any insulin, and that child is insulin dependent for the rest of their life. That number has not increased over the last 200-300 years. What has increased is type 2 diabetes, or adult onset diabetes. And type 2 diabetes is where we ourselves are burning out our pancreas by overloading the pancreas by eating too much sugar. Mm-hmm. And so what happens is that the pancreas eventually says, I give up. I cannot produce enough insulin, or I'm producing so much and the body's just got used to it that it's not actually working anymore. It's like antibiotic resistance. And as a result, the patient then has high circulating amounts of sugar, which then begin to cause the consequences of diabetes. And that is the condition that is intimately related to obesity. That the more overweight you are, obesity is related to the amount basically of starch that you're consuming. So the more sugary, starchy food you eat, the more obese you become. And the more obese you become, the more you strain your pancreas. The more you strain your pancreas, the more risk you are of having diabetes. People will ask, as you've asked me before, is there a genetic element? Yes, there is a genetic element. It runs in families. However, it is not the death bell. It is simply that you now need to even tighten your environment even more to prevent that diabetes from manifesting. How? By the diet. We know that we talked about obesity, where you do bariatric surgery and you reduce the size of the stomach. We know that people who are type 2 diabetic become non-diabetic because they lose so much weight. So we know simply by losing weight, they stop becoming diabetic. We stop their pills because their sugar is dropping too much. So the pills that are used to control the diabetes are the pills that will manage the diabetes, but they will not cure the diabetes. So with with type 1 diabetics who don't have any insulin, they unfortunately are, until perhaps the next 20-30 years where we develop an artificial pancreas, are reliant on insulin for the rest of their life. But by the time a type 2 diabetic often comes to us, they have gradually become overweight. They've gradually exhausted their system. So 10 or 15 years have occurred where the sugar has been steadily rising and has caused complications, which is what we see. We see a diabetic with high sugar almost always has blood pressure, almost always has some degree of diabetic eye disease, almost always has some degree of kidney damage from the diabetes, almost always when we do a scan of the heart has diabetic heart disease, or will develop it in their lifetime, or will have a heart attack, or will have a stroke. They are all interlinked. So as a result, the platform for the management of type 2 diabetes is, yes, the pill to control the sugar, but ask why is it that my sugar is high, and then control those things in addition to controlling them. Because eventually the doctor will say that your sugar is so well controlled, let's start cutting back on the injectable insulin or the pills that you are taking. And it is something that is treatable and reversible, but it requires lifestyle.
I want to understand that reversible aspect of your perspective or your insight. What does that mean? Does it mean that somebody, if they stick to a healthy lifestyle for the rest of their lives, then they would be cured of diabetes?
Absolutely. I would put my hand on my heart and say that if a patient is able to control the elements of their diet that are contributing to their sugar levels, they will no longer need to use their pills. The issue is, unfortunately, we are confronted with, like we started in our introduction, you are faced with an individual in whom you will prescribe the diet. But they're not able to follow the diet for a number of reasons: financial, monetary, social, emotional, physical, mental, stress related. So people don't live in glass houses. People don't live in a square room. They live in an environment. They interact with people. They go out to parties. They have stressful bosses. They have marital issues. They have financial issues. They have emotional issues. And so to regulate that is difficult. You know, we're not monks. We're not priests. We sin. You know, we're able to enjoy ourselves. However, if one is able to control and tighten the influence of the industry on what we eat. We've talked about the power of the industry, the power of marketing, the power of persuasion, where a child will tell you, I want a can of fruit juice because it's healthy, because it says that 100% fruit, no sugar added. They don't have to add sugar because there's so much sugar in there already. But the marketing industry will get away with it by saying no sugar added. So people think it's healthy. You know, so it's a combination of things that will actually control and reverse some of the effects of the diabetes that we see in our country today.
See you again soon when we move on over to another lifestyle disorder, stress